This comprehensive study examines the Ukrainian market for anti-cancer drugs, temozolomide and dacarbazine, to assess their accessibility for cancer patients. Temozolomide and dacarbazine represent the core medications in the L01AX group known as other alkylating agents. Cancer treatment encompasses multiple approaches, including surgery, radiation therapy, chemotherapy, and targeted therapy options. Alkylating agents work by directly damaging DNA, disrupting cell division, and ultimately causing cancer cell death. Temozolomide targets multiple cancer types, including melanoma, soft tissue sarcomas, and uterine cancers, according to Ukrainian protocols. Dacarbazine treats melanoma, soft tissue sarcomas, and metastatic disease as an alternative palliative therapy. Let's examine how L01AX group medications are registered and distributed in Ukraine's pharmaceutical system. While 29 L01AX drugs are officially registered, only 8 are actually available on the pharmaceutical market. The L01AX group divides into temozolomide products comprising 79% and dacarbazine products making up 21%. Germany dominates as the primary drug source at 37%, followed by Spain at 30%, Czech Republic at 15%, Switzerland at 11%, and the UK at 7%. Capsules represent the dominant dosage form at 74%, significantly outnumbering injectable powders and lyophilizates at 26%. Now, we'll assess which registered drugs patients can actually purchase through Ukrainian wholesale suppliers. Temozolomide and dacarbazine Medak both come from the same German manufacturer Medak, representing the main available market options. Temozolomide connects to Swiss manufacturing through Merck Sharp and Dome Idea, offering an alternative supply chain. Our methodology involved 10 months of tracking wholesale prices in both Ukrainian hryvnias and US dollars. The US dollar strengthened 13% against the Ukrainian hryvnia from November 2023 to August 2024, providing our currency baseline. The research followed a systematic sequence: price collection, currency conversion, accessibility calculations, and comprehensive market analysis. Temozolomide price analysis reveals complex dynamics across different dosages from 2 wholesale suppliers. Temozolomide prices showed 2 major peaks in December 2023 and March 2024 across all 5 dosage strengths from 20 mg to 250 mg. Price increases affected dosages differently, with 20 mg, 140 mg, and 250 mg rising 22%, while others showed moderate growth. Temozolomide pricing behavior differs significantly as it comes from a single wholesale distributor. Temozolomide experienced one dramatic price jump in March 2024, increasing 41% in hryvnias and 25% in dollars, unrelated to currency changes. Currency impact proved less significant than actual price growth, showing pricing decisions independent of exchange rates. Dacarbazine Medak powder shows the most stable pricing pattern among all monitored anti-cancer drugs. Dacarbazine prices remained remarkably stable, with only 7% growth in hryvnias and actually decreased 5% in dollar terms. Dacarbazine uniquely showed opposing trends, with hryvnia prices rising while dollar prices fell, contrasting other medications. Average salary changes directly correlate with drug accessibility, revealing crucial socio-economic factors affecting medication affordability. Ukrainian salaries grew 14% during the study period, closely matching the 13% currency devaluation, with peak earnings in June 2024. Salary growth, currency stability, and price controls converged to influence drug accessibility, with peak accessibility during high salary months. Comprehensive accessibility coefficients reveal the complete picture of medication affordability throughout the monitoring period. Acceptable accessibility occurred in 87% of monitored months, with only 13% showing problematic liquidity coefficients above 0.15. The highest salary month in June 2024 directly linked to the best drug accessibility through improved purchasing power. A stark contradiction exists between comprehensive drug registration and limited physical market availability. The National Essential List contains 30 drugs, the state formulary includes 27, but budget procurement covers only 6 drugs. Multiple regulatory mechanisms aim to improve market access, yet significant gaps remain in reimbursement and price registry coverage. Available drugs fall dramatically short of patient needs, with only 28% of registered medications physically accessible. Only 6 drugs representing 21% of the L01AX group entered the state budget procurement list for cancer treatment programs. The research conclusions encompass registration analysis, price monitoring, accessibility assessment, and policy recommendations for improving cancer drug availability.